Good afternoon, and thanks so much for joining in. It's been nearly 3 months since we announced the first cases of COVID-19 in Montana. We did take early and aggressive actions to suppress the virus and to protect our healthcare workers on the front lines. We know those actions saved lives, and early intervention prepared us to be one of the first states in the nation to reopen. I also recognize that these past 3 months have presented significant challenges to Montanans and really have been forcing a new normal. The virus has threatened our health and safety and has had a widespread impact on the nation's economy as well as Montana's. During these difficult times, I have repeatedly witnessed Montanans rising to each and every challenge. Montanans have practiced social distancing, limited gatherings, and boosted sanitation efforts. They've identified creative ways to stay in touch with neighbors and loved ones who are at high risk and need to stay home. Individuals, businesses, and nonprofits have done incredible acts of kindness and service across the nation to support those in need. Some businesses have shifted their business model to respond to a direct need created by the virus. Others have engaged in thoughtful planning to reopen while keeping their employees and customers safe. Through these continued collective actions and a commitment to taking the virus seriously, we're nearly 2 weeks into phase 2 of the reopening. At the state level, we've acquired and continue to acquire the personal protective equipment and other supplies our healthcare workers and those on the front lines need to do their job safely. And we put it into place testing protocols to understand how prevalent the virus is in our communities, test widely and frequently with a goal to stay ahead of a major outbreak. These actions have supported our efforts to stay open. But of course, to continue this path, we all must remain committed. The virus is certainly still here with us, and we must keep learning how to live with it and to mitigate its spread. In Montana, we are scaling up testing to prioritize vulnerable Montanans and also offer surveillance testing in tribal and tourism communities, and even going beyond that. 8,399 tests have been processed from this past Monday to last night. And by following the new CDC recommendations, we're also testing people who came into contact with a positive case, even if they're asymptomatic. Now, with this widespread testing, we do expect to see new cases. But these cases also serve as a reminder that we cannot get complacent, and that if unchecked, this virus will spread quickly and quietly. Following Memorial Day weekend, many states across the country are experiencing a surge of new cases that are certainly causing concern. While some of these cases may be due to an increase in surveillance testing across the country, 9 states are experiencing an increase in hospitalizations of people who are very sick, which indicates that these individuals certainly weren't identified through asymptomatic testing. In Montana, local and public health are working carefully to perform contact tracing, to get exposed individuals into quarantine, and to eliminate chains of transmission to keep the virus under control in our state. While these efforts are certainly critical, we also need Montanans to keep doing their part. That means continuing social distancing, wearing a mask in spaces and places where social distancing is difficult to maintain, washing hands frequently, and by all means, staying at home if you're sick, and seeking a test if you're experiencing symptoms. Additionally, there's guidance informed by public health experts to mitigate risk in restaurants and bars, gyms and fitness centers, childcare facilities, and other businesses. Implementing this guidance if you are an owner and following it if you're a patron will make a meaningful difference in keeping our friends, families, neighbors, and those who are most vulnerable safe. As the weather gets nicer, I know Montanans are itching to enjoy the activities that make summer in Montana completely unparalleled. I'm encouraging everyone, including our visitors, to plan activities in a responsible way and to continue to take precautions. Montanans should certainly spend more time outdoors where transmission is less likely, but also be cognizant of the actions you take. We can find ways to enjoy the Montana summer that we all look forward to each year while continuing to mitigate the virus and staying open. Last week, I provided some information on the cases that had been identified mostly in Gallatin, Bighorn, and Yellowstone counties. Local county health and tribal health have been investigating known cases and working to identify all possible contacts to fully understand how the virus is spreading. So far, most of the cases announced this week were either known contacts of an already identified case or were household members of one of those known cases. After a few weeks without reported cases, activity in Gallatin County has increased with about 25 cases in the last few weeks. The majority of those cases are clustered in large households and social groups. While a few cases in Gallatin County are still under investigation and community spread is always a concern, there does not appear to be any widespread community transmission occurring at this time. Public health officials and providers in Park and Gallatin counties are watching the situation closely and testing as needed. Earlier today, it was announced that 2 inmates at Montana Women's Prison tested presumed positive through the Department of Corrections testing of asymptomatic inmates. State lab is currently verifying the results of those tests. Quarantine and isolation measures were implemented immediately, and Riverstone Health in Billings is conducting contact tracing of those who might have been in contact with those 2 presumed positive cases. To take additional measures, all inmates and staff at the prison were tested. Those results are pending. To date, as part of its Sentinel testing efforts, the Department of Corrections has tested 616 inmates among all of its facilities and 102 staff members. These 2 cases mark the only presumptive positive results that the department has received. Last week in Bighorn County, we were able to identify an additional 11 cases through careful contact tracing. In Gallatin County, cases were identified through contact tracing as well as through increased surveillance testing. Now, I do understand that Bighorn County, which has reported 43 new cases and 1 death over the last couple of weeks, has decided to implement additional guidance to try to contain any possible further transmission and spread in their community. Those measures include requiring temperature checks for employees and reducing restaurant and bar capacity to 50% and limiting the number of people seated together. I'm certainly asking Montanans to continue respecting local decisions in our tribal nations or in other localities to keep the virus as contained as possible. Next week, the Confederated Salish and Kootenai tribes will conduct community testing with support from the Montana National Guard and supplies provided by the state. Yesterday, I was at the Northern Cheyenne Nation. After 3 days of testing, they completed over 1,700 tests. When we get CSKT, please, that'll mark all 8 of our tribal nations completing community testing. We're continuing to work together then to ensure that a schedule is put so additional testing will be occurring in our tribal nations going forward. Emergency rooms that are interested in offering testing have now been shipped kits and will begin offering each patient that enters into an ER a COVID-19 test. The vast majority of our larger hospitals in the state have already agreed to undertake that offering to test some or all of the ER patients. Southwest Community Health Center in Butte will start offering testing weekly on Mondays, Wednesdays, and Fridays. This is part of our continuing focus to set up community health centers across our state with the capability to offer to test patients. Understand that Peer View here in Lewis and Clark County, again this weekend on Saturday, will also be offering drive-through testing. We're continuing to test in nursing homes and assisted living facilities. Of the 71 long-term care facilities in our state, 50 of them have completed testing. We anticipate the testing of willing long-term care facilities will be completed in the next couple of weeks. Of the 217 assisted living facilities we have in our state, 51 have completed testing to date. That marks over 3,600 staff and residents been tested to date in nursing homes and assisted living facilities, and no positive tests have been identified in this vulnerable population to date. And finally, we continue to build on making community testing available in our tourism communities and to support businesses and the tourism industry as they reopen in Montana. The state's partnering with local public health, federally qualified community health centers, and businesses to begin voluntary testing of employees and those who come in frequent contact with others. These testing events are certainly, though, and we have to remember, just a snapshot in time. Yet it'll hopefully serve as an early warning system and prevent a major outbreak due to travel into our state. Many of Montana's tourism communities have been working diligently to develop and implement plans to offer community testing and prepare for any new cases in the area. Red Lodge, Livingston, Gardner, Whitefish, and West Yellowstone are the areas initially identified to host community testing to identify new cases and quickly respond to any outbreaks. Red Lodge has partnered with the state to offer quick and free testing this Friday and Saturday and is calling on frontline workers who frequently come into contact with locals or visitors to come get a test. Also, I guess I do want to commend Carbon County for the great work that they've done to organize a testing event and do outreach through radio and social media to ensure as many people as possible know that they can get access to free testing this weekend. And the work that they've done can easily be shared with and implemented by other tourism communities as they make plans to offer community snapshot testing. Additionally, the state is also putting together customizable promotional materials that can be edited to change testing information and the location for local testing centers to be posted outside testing centers or to be shared over social media. Those materials will be housed on covid19.mt.gov for our partners to download and edit. Gardner and Livingston will also begin community testing next week. Flathead area is currently working on its plans. Next round of communities we'll be partnering with to stand up testing are Ennis in Madison County, Missoula, St. Regis in Mineral County, Glendive in Dawson County, and Miles City in Custer County. We are also reached out recently by Roosevelt and Valley counties, which want to do some greater testing. We're working with them. We'll be working with them to get that up and running. As the state and our local and tribal partners continue, and all of us work to keep the virus suppressed in Montana, continue to ask that all Montanans join us in this effort and keep taking precautions to protect one another. I'll now open up for questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised when we unmute your phone. You'll be notified that you've been called on to ask your question, so please. First question.
Hi, Governor Bullock. Hi, Governor Bullock. This is Maritza Giorgio from NBC Montana. 2 questions. I spoke to an economist at UM who says his biggest concern moving forward is for state and local governments, which can't go into a deficit. Do you share those concerns? Are we still in good shape in your mind? And also, can you expand on what's happening at the Montana State Women's Prison? Are they on lockdown? Do you know where those folks may have gotten COVID-19? And can you tell us the ages of the 2 patients?
So, first question, Maritza, the economist saying that significant concerns for revenues at local and state governments. Look, as I noted a couple weeks ago, Montana is in a much better position than many states. I mean, that's as a result of leaving an unobligated general fund balance of $360 million. And we project in this fiscal year north of $280 million. We came out of the 2017 legislative session with the budget stabilization reserve, which also has $117 million in it. We have $55 million in our fire fund. So we're in much better shape than most states, by all means. But that doesn't mean that as we look forward that there isn't concern all across this country. I mean, it was raised again. The Vice President made reference to it in a call that we had with him on Monday, that at the federal level, they're talking about, you know, the prospects of addressing some of those concerns sometime in July. But we'll continue at the state level to do 2 things, one of which is carefully manage the dollars that we have, recognize that we want to be able to provide the essential services that Montanans expect without doing cuts, and moving forward, both looking at what the revenues are coming in along the way. And we have been talking to some of our local government partners as well, and we'll continue to do so. To the second question, no, I don't have all the details. I guess I would say that my understanding was that they were 2 women. I don't have their ages. We might be able to get that to you. Both of them were asymptomatic at the time, so without symptoms when we found the test. And I also said to note that, well, it seems like a minor thing. I said that these are presumptive positive tests, not positive tests. So that those tests were processed through our reference lab provider, Quest, which we're doing a bunch of work with as we amp up wide-scale surveillance testing. Whenever we get a positive test from elsewhere, then we still want to run it through the state lab to ensure that that we're finding the same thing. Please, next phone question.
Governor, this is Kevin Trevelyan with Yellowstone Public Radio. I'm curious if you're in touch with governors from neighboring states, maybe regarding a plan on final stage reopening or even looking ahead to a second coronavirus wave.
So the question is, have I been in touch with neighboring governors when it comes to final stage reopenings or the prospects of, I guess, a second coronavirus wave along the way? So typically in weekly calls with all of the governors around the country, my last conversations, I think, with the governor of Wyoming were around the phased reopening of Yellowstone Park. Had conversations with the governor of North Dakota a couple weeks ago. Neither of them, though, directly on those, the issues of what a final reopening might look like. And I think, as we're actually seeing 21 states having increasing cases over these days. Look, Montana will act sort of on its own accord, but I think all over the country we're probably a little ways from thinking that we're all back to normal right now. The next phone question, please.
is Nikki Willett, also from Yellowstone Public Radio. Thanks so much for holding this press call today. Apologies if this has been addressed in previous calls. I'm curious if the state is monitoring where antibody or blood serum testing for COVID-19 is happening, and if results from that type of test will somehow be included in the state's data on that dashboard.
So directly the question of Nikki, and we'll follow up as far as what specific antibody testing might be occurring already out there, that hasn't been at all on our state's dashboard, because what we've been showing is, through the PCR tests, the positive tests. Now, we have been at the state level, we've started discussions about, as both the technology and the tests have been evolving and improving, and there's greater levels of comfort of the potential for, as we look into the upcoming months, availability of antibody testing, but we're just starting to undertake that.
Thank you.
Thank you. Next question, please.
Hi, this is Paul Schwedelson from the Bozeman Daily Chronicle. I guess two questions. I was just wondering how close, or maybe where the future might lie in terms of approaching phase 3 and what the threshold might be for that. And as well as just, you mentioned talking about community testing in Gardner and Livingston. I was just wondering maybe if you could expand on that and maybe what that might look like, and kind of what the timeline is, and what that looks like going forward.
Yeah, to the first question of like getting to a phase 3 where there essentially are no restrictions, I think that, look, we're not even 2 weeks into phase 2 where we're now allowing out-of-state visitors to come without quarantining, that getting our group sizes up substantially, and or at least allowing that to happen, and increasing capacity at our restaurants and other places. So we've got to see where the virus goes. I mean, anybody that thinks that we'll be getting to phase 3 soon in Montana or anywhere around the country where there'll be absolutely no restrictions, I think that's probably a little bit optimistic, at least in the immediate term. And to the second question of in Gardner and West Yellowstone, I'd encourage you to talk to Matt Kelly, the public health officer, because we've been in sort of discussions with them, and they're doing the work and working with the local communities on exactly what it'll look like on the ground there.
Thank you.
Thank you.
Governor Bullock, John Riley, MTN News. This Sunday there is a planned Black Lives Matter rally, and they're expecting hundreds of people. First, are you or any of your administration planning on attending? And are you worried that this might be a place where COVID could spread?
To the first question, John, I think I'm going to be out of town. I haven't talked to members of my administration whether they intend to participate, but certainly that is up to them. And I'd certainly encourage any gathering of people to be as protective as possible. Practice social distancing when it's practical. Wear a mask. Take those steps to protect one another. But I also think, that as we've seen, not just in Montana, but around the country, I mean, that there are, folks are in pain in some respects as a result of what's happened. And it's great that there's even discussion now in Washington, D.C. about, and that's Democrats and Republicans. So we've got to protect avenues for peaceful First Amendment expression. But directly, look, anytime that there are gatherings of individuals that come from a large cross sections that, I have concerns about the possibilities for positive tests, but same was true through graduation parties and things like that as well.
Hi, this is Iris Samuels from the Associated Press. I'm hoping you can elaborate on the current state of CARES Act distribution. Do you have any plans for new ways to distribute funds or to expedite distribution in the state?
Yeah, a couple of different things are that, yeah, the first 9 programs were launched to the public exactly 5 weeks ago on May 7th. In even that amount of time that so far, staff has been diligently working to both review the applications that come in the door. 4 weeks, we've put out 31 million has gone out the door. Sizable chunk of those dollars have not been allocated yet as far as the overall CARES Act for a couple different reasons. One is we need to see what the funding requests are that come in from local governments, which we're still working with. Even the coronavirus relief funds said that we should put some money out immediately, address additional needs all throughout. I think by probably next week, we'll be rolling out a loan deferment program, which has a sizable amount of money as well. Another thing that, you think about even today, the federal government, Secretary Mnuchin said that they weren't going to give any details on the $500 billion that are given out to airlines and other businesses, or any details of the Paycheck Protection Program as far as the recipients. We want to make sure that there's the sunshine and transparency for every recipient. We also want to make sure, though, that, look, it takes, because we have that responsibility with taxpayer dollars, it also, though, takes a bit of time, even with these, to get the required verification information back from those grant recipients. Housing grants, you have to get a hold of both the tenant and the landlord, or the homeowner, or the bank. You have to get W-9s when it comes to the individual for the business stabilization grants. And so there's still more to certainly do, and we'll continue to both be transparent on getting that money out and what the programs are for it. I guess I should also, it's interesting in some respects too, because like if folks have applied for a business stabilization grant and haven't gotten the money yet, that's frustrating. And I'm have my share of frustrations as well. I've incredible people working on this. To put this in context, like the Department of Commerce, fiscal year 20, they awarded 347 grants. In 2 programs alone, they've already gotten 2,130 grants out just in the last few weeks. So continuing to both push good folks, work an additional 40 staff from other agencies to, check to make sure that those that are requesting the money, that we should be getting the money out and using it for the funds are best support Montanans who need it most. Anything else? Great. Well, thank you all very much.